So management is mostly supportive. So you will give supportive and symptomatic treatment, and then we will monitor the complications. So as we have seen that the patient is having so much pain and vomiting and nausea, so we'll keep the patient nothing by mouth, nothing per oral, so that pancreas will have rest. Then NG aspiration is done if the patient is having vomiting. So next is the analgesia. So if the because we have seen that the patient is having severe pain, so we have to get the pain relieved. And for analgesia, you should remember that opiates, these are preferred. Fentanyl and mepridine are preferred over morphine because morphine causes increase in sphincter of body pressure. So just remember that preferred analgesics for acute pancreatitis are opiates. Then we have seen that there is dehydration, the patient can go to acute renal failure, there is volume depletion, and for that purpose we will give IV fluids. You can give crystalloids or colloids. So keep the patient NPO, do NG aspiration, give good analgesia and fluids, and electrolyte monitoring is done. And then we have to finally monitor and treat the complications as per patient. So let's see what are the complications and how we'll manage them. First is shock, that the patient can go into shock. The patient can have hypotension because there is volume depletion, the blood pressure can go down. So for that purpose, you have to give fluids. You have to keep an eye and you have to give fluids so that the blood pressure is restored. Then, if the patient is presenting with acute respiratory distress syndrome, then you will provide with oxygen and it may require patient admission to ICU even. Then, next complication is DIC. There can be disseminated intravascular coagulation. There can be DIC and it is rare, but it is very, very life threatening. So, for that purpose, you will give blood products. Next is infection. Yes, infection is again very common, and for that purpose you will provide antibiotics. Next is pseudocyst. As we have seen that encapsulated fluid collection can occur after an acute attack of pancreatitis. So it is called pseudocyst because it is not having true epithelial lining. So if pseudocyst has developed, that you will found out on CT scan, you will have to provide percutaneous drainage. And again, if there is abscess, you have to give antibiotics plus percutaneous drainage again. And if there is pancreatic necrosis, that the necrosis of pancreas has started, then you will have to give operative resection for that. So these were the complications that you need to monitor carefully and manage so that the patient can revive. So this was all about acute pancreatitis, and stay tuned to sqadia.com for more.